So hello everyone, and welcome to your videos for CS4. So this series of videos is going to focus around wound assessment and wound healing. So this first video is going to be about your initial assessment. Your initial assessment for any wound, you might do it by the patient. We've got Simman here lying in front of us. If it's a wound that that is a new wound or something that there is no documentation about, or you could actually do it away from the patient because you might be able to get the information that you need from the notes. Obviously you might still want to ask the patient some questions, but if there's a care plan about this, or if it's maybe you want to look at the operational notes or something about the patient, you could do that away from the patient. There's four initial questions you want to ask. The first of these questions is, what was the mechanism of injury? Now the mechanism of injury, so how was the wound created? So that can give you insight into what type of wound it is and therefore how you want to close the wound. So for example, a blunt force could result in a laceration, so a tearing of flesh, or tearing of tissue. So that might, you might think about how then the tissue is then going to meet. It could be an abrasion, so the tissue could have been scratched off through a fall or something. For example, if there was an abrasion on the face, so they had a big graze on the face, how would you make sure that there is a good cosmetic result? How would you make sure that healed well? It could be an incisional wound, so this patient here has an incisional wound by a surgeon, so they've had their abdomen cut with a scalpel. That is in a clean environment. It's used a sharp object to cut the wound, so that will make sure the wound edges can meet quite nicely. Is it a puncture? So has the patient been stabbed or hit with a long device that has caused a deep injury, but you will only be able to see a very small part of that injury, a very small wound, but there might be quite deep problems going on. Is it a ulceration? So is it a breaking down of tissue, so a deterioration of tissue? And those patients, we wouldn't necessarily be able to get the wounds to meet. We'd want to think about healing it in a different way. So thinking about our closure method for any one of those, we either want to close the wound in theatres with a formal debridement, a cleaning of the wound and a formal closure of the wound, or we might want to close the wound with primary intent. So we might want to bring the sides of the wounds together so that we could close it with either sutures or maybe stereostrips or tissue glue. So maybe an incisional wound or a cut would be good for that. We might want to close the wound with secondary intent. So that is when we heal the wound from the bottom up. So an ulceration, we might want to try and think about what has caused the ulceration, try and reverse that or prevent that happening again, and then using dressings to protect the wound and make sure the wound heals nicely. Or maybe an abrasion, we might want to make sure there's nice clean dressings over the wound with a good environment to allow it to heal with a good cosmetic result. So that's our first question. The other three questions are, where is the site? So where is the injury? So if it was on a leg, if it was on a lower leg, is there good perfusion to that lower leg? If it's on the face, do we need to think about cosmetic results? If it's on the abdomen, if it was a puncture, what structures has it injured, or on the chest, for example? If it's on a joint, which flexes a lot, what kind of sutures do we need to make sure that wound stays closed? The third question is, when did the wound occur? Was it a long time ago? Was it very recently? If it's over a certain period of time, you might not want to close the wound straight away. You might want to bring the wound edges together and give them antibiotics and then formally suture them, so a delayed primary closure. And also, where was the patient when the wound occurred? Were they in a nice clean skills lab when they had their injury, so sort of a relatively low risk of infection, or were they, for example, in a horse stables and they got a pitchfork through their hand or something? So that's a very dirty environment. And then when we're thinking about that, we might then think about, is their tetanus up to date, or is that something we need to consider? So thinking about tetanus brings into some other questions, some other considerations. So obviously tetanus is important. We then want to think about some things that are quite common across many practical skills. So do they have any allergies? Are they on any other, have they got any previous injuries or any kind of damage to that area? With wounds, we also want to think about, do they have any implants, some joint replacement, or maybe a pacemaker? And we might need to then consider some prophylactic antibiotics, but also what medications is the patient taking? Are they taking things that asthma anticoagulants like warfarin, which might cause them to bleed? Are they taking steroids? Are they taking non-steroidal anti-inflammatories? Things that might reduce their ability to heal. So those are some good things to consider about the patient. And then when we've thought about those, we also need to think about the patient as a whole. So are there factors in this patient's lifestyle that's going to be affecting wound healing? Obviously some of these might not be quite so important for injuries that occur, but some of them are really important. So if this patient has an ulceration and they have a pressure ulcer, for example, on their heel, then we need to think about how we're actually going to be relieving that pressure so that ulcer doesn't occur again. We might want to think about the patient's previous medical history. Have they got diabetes? Have they got maybe a poor perfusion to their lower legs? How old is the patient? Their age can affect healing. It might affect how you're actually going to close the wound. Are they a smoker? That can reduce wound healing. What's their mobility like? So poor mobility, can we increase mobility? If we can't increase their mobility, what can we do to try and prevent the pressure in these wounds occurring? Are they incontinent? Do they have an ongoing infection or sepsis within their body, which is actually going to impede wound healing? So those are some really important factors to think about, because if you don't address some of those factors, the factors that you can address, then actually it doesn't matter what dressing you put on the patient, it's still not really going to be as effective as it could be. Okay, so that's our initial assessment, which you can do away from the patient or with the patient. And once we've done that, we've thought about those, we might need to then actually assess the wound itself, which will be in the next video. Thank you very much.